Are you ready to clear the air and reclaim your life? Join me, Dr. Kevin Smith, as we dive into the conversations that matter: health, happiness, purpose, and passion. From migraine breakthroughs to lifestyle transformations, we'll explore it all on Clearing the Air, a prescription for life. Hello, everybody. I'm Dr. Smith, and I have a wonderful patient with me today, Rehanne. Hi, Rehanne.
Hi, Dr. Smith. How are you today?
I'm wonderful. I'm so glad you could meet with me today and be on the podcast, because I think we have a lot of great stuff to share with people out there.
Yes, we do.
We do.
There's a big story to share.
Well, let's just jump right in then.
Okay.
So you're a patient of mine,
Yes.
and you came in with a myriad of medical issues.
Yes, definitely.
The main ones, you had this ocular migraine that you've had for some 13 years.
Yes.
You had the nasal airway obstruction.
Yes.
And you had the eustachian tube dysfunction, kind of ear symptoms that went along with that.
Yes.
But you have a host of other things too. You want to elaborate on those things too that you've been dealing with?
I've had depression since I was 9, anxiety since I was 11. And as I've gotten older, well, at 11, they also diagnosed me with bipolar disorder.
Okay.
And then as I've gotten older, I've developed schizoaffective disorder and PTSD and a lot of problems. And I see a good therapist for that, Dr. Anapathist.
Wonderful.
But yes, it's been very difficult to deal with those. Plus, I've had a myriad of health problems alone. Right now, I'm dealing with hypotension. And the problem with that is all my tests look fine. You know, the echocardiogram and the other thing, I've got a stress test next week I have to do.
Okay.
And they still can't figure out why I'm fainting and dizzy.
Okay.
Yeah.
Gotcha.
So that was one of the big things I think that really sent me downhill, because it just gotten worse and worse over time.
So let's talk about, why did you come to see me? I'm an ear, nose, and
Actually,
throat doctor. I do facial plastic surgery. So let's talk about that. How you found me, why you sought me out.
I was searching for doctors in the list of my provider network, and the soonest appointment I could get was December 26th
Okay.
at Kelsey Siebold. And I said, this is not going to work. I can't live like this any longer. And I happened to see your name. And I said, when does Dr. Smith's first appointment? We can have you in tomorrow. I said, great. I said, take me.
Good.
And it was like God guided me to you, because honestly, I think if I hadn't gone to you, I would have ended up seeing more ENTs, because I've seen 5. You're the 6th one I've seen.
Okay.
And, you know, they all tried to blame my sinus problems, especially the hole in the middle of my septum one. You know, oh, well, that's no big deal. And they'd stick the camera in through the, like, inside out of the septum and play with it. I'm like, this is not right. And I felt gaslighted by one. I felt like one wanted to just do surgery, all these surgeries without looking at things properly. There was a lot of that going on.
So did you come to see me mainly for the headaches, or the headaches and the sinus and just all
The
those
headaches,
things?
yeah, the headaches was a bonus. The sinus was really what I was
The main
concerned
thing.
about, and then my ears too.
Okay. And how were those impacting you? Talk about it. Were you getting a lot of sinus infections, having
Yes.
trouble breathing? Were you snoring? Or
I was snoring really bad. I mean, you could hear me in the other apartment. I was snoring so loud.
Wow.
For my whole life, I have snored so loud you could hear me in the living room of my apartment, even in the
Okay.
living room of our house when we lived in a house.
All right.
You know, I couldn't breathe right. I was a mouth breather, you know,
Mhm.
and it was hard because, you know, you walk around in public and people think you're dumb because you're a mouth breather, that, you know, something's wrong.
Right.
You know, I was constantly getting ear infections. My ears were getting backed up and I could not figure out why. I kept saying to doctors, I need tubes. That's
I
the only
see.
way it's going to
I
stop.
think you even asked me about that when you came in. You're going to put
Yes.
tubes in my ears? I said, no, I don't think you'll need that. If I take care of the root cause, everything ought to clear up. Were you having any muffled hearing, dizziness, ringing in the ears, that kind of thing?
All of it.
All of that. I'm glad you said you had all of that, because a lot of times people don't understand the impact that nasal airway obstruction can make on your ears, your throat, your sinuses, causing headaches, causing runny nose, all of those things, because you are just blocked up in your nose.
Yes.
So you come to see me. Let's talk about that.
I came to see you and I was quite surprised because the amount of time you took with me to honestly discuss the problem, and the scan you did on my head, the CT, that really surprised me because I had one do one and I couldn't even see anything in it.
Okay.
And there's nothing wrong with you, but I'm like, I can't even see my nasal structure. So
Right. Well, that's what we do. Just so I can tell the folks out there, we have a scanner in the office. So The good thing is you get to come in the same day and get your exam, your scope, your CT scan, and then I go over the CT scan with you, point out the abnormalities, talk about what needs to be done to get it fixed, talk about the potential risk and benefits, and then we schedule you all,
Yes.
all in the same visit, right?
Yes.
That ha-
Exactly.
okay. So when I went over the scan with you and I started putting the puzzle pieces together and explaining to you how if I did this, it would clear up all these issues that you had, what did you think?
I was actually surprised about how many problems I had and how ignored they were over the years because they always blamed it. Oh, well, you need a sleep study because that's why you snore. Or, oh, you need a sleep study for this. Or, oh, well, there's nothing we can do to help you. You're fine.
Hmm.
You know, like I went for a sleep study recently at a local hospital a couple of years ago, and they almost broke my cheekbone because the pressure was so tight. I ended up leaving at 3 in the morning. I said, I can't do this. I called my husband to pick me up. I said, I'm sorry, but you're going to break my face
Hmm.
and you're hurting my whole mouth and chin.
That's another very good point I want to make. I am dedicated to finding the root cause of problems.
Yes.
When you tell me you snore and can't breathe through your nose, it's imperative that I examine the nose for any abnormalities, examine the throat for any abnormalities,
Yes.
fix the nose, fix the throat, and let all the symptoms go away. That's sort of how I do this. It's
Hmm.
pretty cut and dry. And so to have you say that you've heard a variety of answers from a variety of ENTs about your condition goes to show you there's a lot of different, I guess, ways of practicing, a
Yes.
lot of different philosophies out there. And some of them get you feeling better, others don't get you feeling any better. They leave you frustrated, I would imagine.
Well, because I don't know how I got this hole in my septum. The only thing I know is I had sinus surgery back in 2006, shortly
Yes.
after I married my husband in January. And he said, oh, well, there's a vein that needs cauterized. Well, he never did it at that visit. I'm like, why won't you do it? And then he just shoved me out the door. We felt so, I guess what's the word I'm looking for? So just
Ignored or
disenchanted,
dismissed.
disenchanted,
Hmm. Yeah.
and I was like, that's somebody I don't want to see again.
It could have happened. She has a large a large septal perforation in her nose. And it certainly could have happened from your previous surgery.
Yes, I
Yes,
believe so.
it certainly could have. So you have your procedure. No, let know before we get there.
No.
Here's the big moment we want to get to. The day before your procedure. Let's talk about that.
Yes, the day before my procedure, which was supposed to be in office, I said, "Can I sign a DNR?"
And for those out there that don't know what a DNR is,
It's a do not
do
resuscitate.
not resuscitate in case something happens. Leave me alone. Let me go.
Yes, it could have been a successful surgery and one thing could go wrong, like the blood pressure drop. And my dad has said that before, but my mom understood when I asked her about it because she's been with me every step of the way through all this.
Okay.
She moved a couple of years ago, but she understands the problems I've had because I got my first set of tubes at 7 and I had my first earache at 4 and it perforated both my eardrums.
Gotcha. Now let's talk about though, because to go in and know that you're having a procedure done the next day, and you get to the point where you're like, I want Dr. Smith to sign one of these DNR forms for me.
Yes.
How did you get to that point? What all led up to you deciding I want that in case something happens?
I've had health problems nearly all my life and it got worse when I was 17 and then it's just spiraled and I'm disabled and it's just you get tired of fighting the battle. You get tired and it's okay, fine. I'm tired. Just take me now. Just take me now. I don't care, because you just get tired and you're strained on your family, financially, emotionally, physically, everything. And so it was like, okay, let's just be done with that and sign it, and you were great enough to call me and you spent a long time on the phone with me talking it out. And you even emailed me as well. And you said, I understand where you're coming from, but you're just tired. I said, I'm not suicidal. I said, I'm just tired,
Right.
and you understood and you were able to settle me down and get me to see that my life would be so much better after the surgery.
Well, the subtitle for this podcast is A Prescription for Life. And so
Yes.
I'm glad we're touching on this. And I'm going to tell you how I felt from my standpoint. So I'm in the office, and one of my staff members comes and tells me that, your patient for tomorrow, they want you to sign a DNR. I'm like, do they have the right Dr. Smith? Because DNRs, I don't usually sign that. I mean, it's
Yeah.
nasal sinus surgery, and so, but I took it seriously. And I said, well, let me just give you a call, because here's what I felt. I felt like I needed to let you know what I hear from other patients who have had the exact same procedure that you were getting ready to go through. The recovery's not bad. They breathe much better. The snoring stops. You sleep deeply. Your ears don't ring. You don't have the imbalance or dizziness. You don't have the muffled hearing. And overall, you just feel great.
Yes.
And I remember, I'll never forget when I'm talking to you.
It's
I heard you giggle.
I did.
You said, Dr. Smith, I'm not going to sign that. I'm going to go through with my surgery. I care about you
Yes, you do. Very much so, I can tell.
just like I do all my patients,
Yes.
because I live a good life. I don't snore. I'm not fatigued chronic. I don't have sinus problems. I breathe well. I don't get headaches. And I'm very fortunate. And I know that because I see people like you all the time. So I was happy you changed your mind. You kind of got that little giggle. And I said, yeah, I got her. I got her.
Mhm.
And so we do your surgery.
Yes, we had to
And
do it at the hospital because
right.
the blood pressure issue, and I felt great afterwards. It was, I snored a little bit, but then it just stopped. I can sleep now without snoring. That's the best part, because now I can't tell if she's awake or what, because we sleep in a completely black room. So he's like, is she awake, or is that just a pop? It's so dark. Yeah.
That's good.
And yeah, I have to remind myself, because for 15, 20 years now, I've been breathing through my mouth. So sometimes I have to stop and remember, breathe through your nose, don't breathe through your mouth,
And you
and
have the cutest nose.
oh,
I
thank
always
you.
tell you that. I'm looking at it right now going, I told her, I said, please, I do facial plastic surgery as well. So I told her, I said, if anybody compliments you on your nose, could you just say, Dr. Smith did it, even though it was on the inside? You can tell a little white fib. No, it is the cutest nose. So you're doing better.
I'm doing much better. My eustachian tubes, if I feel like they're getting stopped up, I just press on the side right here and they drain, real easy. And I can get whatever's bothering me to go down. I don't have the headaches anymore. In fact, my PCP told me I don't have to take Nurtec or Ubrelvy anymore. I can just take my preventative, and
Wait, you were taking Ubrelvy?
I was taking Ubrelvy, Nurtec, Inquilipta, and
Wow.
acetazolamide, Diamox 500 milligrams.
Well, that's good.
Yes, and so I'm due to see my neurologist in January, and I'm going to ask him about getting off the rest of the meds.
So we're getting off meds. We're feeling better.
Yes,
We're living life.
yes,
And one thing I noticed when you came in afterward also, you were talking about a trip that you and your husband were planning that you probably wouldn't have planned had you not had the surgery. Did I understand that correct? Or
yes, that's correct. Because
let's
I
hear
would have
about
been.
that.
It was actually, my husband had the week off, and I was supposed to go visit my father. He was going to pay for the ticket for me to go visit him and my stepmother out in Tucson, Bullhead City. And it's me. He said, we'll take you to the Grand Canyon. We'll go up to Williams, Arizona, and have a good time. And we did. And I was able to breathe easier. The air was drier, but it didn't affect my sinuses because I was doing my rinses. So if you're doing your rinses and you're in a dry climate, you're fine. I mean, it was so dry, I could feel like my fingers going, chapped,
Right.
because it was so dry. And I'd be out there and it'd be windy, and I'm like, why do my fingers feel like leather?
Right.
But yeah, no, I was able to get around with a little help. Sometimes I needed help, but yeah, I was great. And I enjoyed every minute of it. I didn't have to worry about, my heart, my body, and my just getting overwhelmed and feeling too worn out.
Right.
Um, Now, and the great part was I slept every like magic. I mean, it was like so quiet there and so just such fun. I was worn out and I slept like the dead. Literally, I just go to sleep and I just okay, this is perfect.
Isn't that
Wake up.
wonderful?
Yeah,
You
and I'd
sleep
wake up
good.
with full energy in the morning, like ready to go.
Uh,
Yes, and that's
So
all
it
thanks
was
to you.
so it was all worth it.
Yes.
So now let's talk about your prescription for people out there who are suffering from the same things that you had. What do you have to tell them? You were wanting me to sign a DNR. You were so fatigued and tired and fed up and depressed and disabled. What do you want to tell people who feel like that?
I would say if you feel like that, you need to come see Dr. Smith. You definitely need to come see Dr. Smith because he will fix you, you will heal, and your life will be so much better. Your life will be amazingly better. Like my pressure headaches have stopped. And I've been tempted to go into the pseudotumor and pressure migraine community and start saying, hey, go see Dr. Smith because Dr. Smith can fix this and he can, really make it happen because, and I think that's what I'm going to do because it's one of those things where you have really transformed my life. And if you can transform me and fix my life, you can fix anybody's life and anybody who has problems.
Well, it's just what I do. I listen.
Yes.
I know that chronic problems within the head and neck area are caused by some type of a specific abnormality that I need to just find. When I find it, I fix it. I let you heal and watch you get better.
Yes, exactly. You're a wonderful doctor. You're the best doctor I've ever had.
Oh, thank you so much.
I
That's
mean,
mighty
you're
nice of
you're
you.
better than anybody I know, really, because you actually stop and take the time to spend with your patients, even if it runs like an hour and a half. You will take that time with your patients and help educate them and help them see just what a bright future they can have.
Well, and my whole idea about life is it's about connecting with people,
Yes.
spreading goodness and love, and then allowing them to go out and they spread the same thing. So when you say you're going to go out into the pseudotumor cerebri community, let's talk about that. What is that? I forgot about that as a diagnosis that you had as well.
It is a rare condition that affects 1 in 100,000 people. And it's basically your spine and your brain make too much spinal fluid. So that will cause your brain to swell and it will cause eye problems. Like when I first got it, I was having vision problems. I had my eyes checked, nothing, everything came back normal by the optometrist. And then she said, you need to go see this doctor because I'd been sick for months. I couldn't understand why, because I was constantly just getting sick and sick. And when I went to get my vision checked by the ophthalmologist, he said, you need to don't go anywhere. He said, go straight to the hospital and get an CT scan at the ER.
I see.
And they had me ready to go. And they hospitalized me for about 2 weeks.
Did you have a lumbar puncture?
Yes, I had a lumbar puncture. I mean, it was miserable. It's an utterly miserable condition to have.
And they say that the symptoms of the pseudotumor are what? What are the symptoms?
Vision changes, headache, pain, just bloating, sometimes bloating.
Any extremity issues?
Yes,
Tingling?
you're tingling in your fingers and your arms.
Yeah.
There's so much associated with it. If you look it up online, you can find it. It's been so long that I've had it, because still take the Diamox twice a day. I've cut back from 3 to twice a day.
And you might be able to get off of it.
Exactly. Exactly. So I'm hoping, when I see the neurologist in January, I'm really hoping that I can get off all of it.
It would be good if you could wean yourself down and get off of it. Just get back to being normal you.
Yes, exactly. Exactly. But so many people suffer from it and they're constantly going to the ER and they're in horrible pain and they can't get help and their doctors are out of options. And there's got to be more to this.
Well, the thing is, like anything else, you can have pseudotumor cerebri and also have the specific nasal abnormalities that I know cause headaches and migraines.
Yes,
So
exactly.
you can have both. So the big thing is certainly come to me. Let me screen you. We have the sinus scanner right there in the office. It's very quick. It's very easy. It's low radiation, if any. And you get the diagnosis right there. It's not a guesswork.
Yes.
Either you're going to have the abnormalities and I'll point them out to you, let you know what I can do to fix them, or you don't. The good thing is most people that come in, almost 100%, have the abnormalities. So you're more than likely, I'm going to find what's going on and fix it and get you feeling better.
Yes, exactly. That's what you do.
Yeah.
And it was just amazing. I mean, I feel great. It's nice to be able to live my life now and not have to worry about, well, I feel so fatigued for the day. What one thing in the house am I going to get done for today? Because there's a million things that need done. What one thing am I going to be able to accomplish
Right.
today that's going to give me the energy and not wear me down?
You know,
Why do I sound like Darth Vader when I'm in public wearing a mask?
right. And you also told me about how you just felt like your husband was doing everything and you were just kind of isolated.
Yes.
Let's hear about that. What you weren't contributing.
It was one of those things. I just lay in bed all day and sleep. Because I suffer loneliness quite a bit, especially, being home alone and having so many issues. And so it's like you can reach out to people online, but it's just not the same as face to face communication.
Right.
And so I would just sleep all day, and that was the only way. And I felt exhausted too, every day, all day.
So you sleep out. So the day in Rehanne's life is wake up, but then you're so fatigued, you kind of sleep all day. You figure out one thing that you'd like to get done.
Yes.
Your husband's off at work. You're feeling isolated. You're not contributing to the household. And you just doing that every day. This went on for how long?
Oh, this has been going on for a couple of years now, if not more. And,
Wow.
now I can do things around the house to help him because he recently broke his arm.
Yes.
So now I'm taking care of him full time. I'm able to move around and do the dishes and cook the food and all of that.
So your life has changed.
My life has changed completely. It's done a 180.
What does your husband think?
He's surprised, and he's, like I said with the snoring, he's surprised that nobody hears me. Because you may occasionally make a noise, but he's in the morning. I can't tell if you're awake or if it's just a pile of blankets, or, if you get up and you fall asleep in the chair, because I'll be listening to music on my headphones and I'll, snooze and he'll be like, I didn't even know you were up. When did you get up? And why are you sleeping in the chair? Why did you come back to bed? I'm like, I don't know. I just fell asleep here.
Well, I tell you what, if there's ever a person who's the epitome of the message that I'm trying to convey through this podcast, it's you. Because you, like you said, you completely turned a 180 from being fatigued and tired and lonely
Yes.
to now you contributing and living life and going on trips and not having headaches and getting off your meds. So this truly has been a prescription for your life.
Yes, it has. And I'm just so grateful to have you in my life as a doctor and hopefully as a friend as well, because you have really changed my outlook on life as far as the way not to give up. When I won that DNR sign and you took the time to call me personally, when you called me personally about things, you have really been exceptional because most doctors don't personally call you. They have the nurse do it. But when you called me about that DNR, you really convinced me and you made me feel like I was going to be safe in good hands. And now I know I was.
Well, I'm so happy you decided to go through with it.
Me too.
I'm glad I didn't have to sign my very first DNR form the morning of surgery. And I'm just so happy that you're doing well and happy that you came on because you told us, now let's go back to this. When you first came in, you were a little rough with some folks. Let's talk about that. And rightfully so, your fuse was short, right?
Yes, I have a short fuse.
And that was probably because of all the headaches and the problems and your frustration.
Yes, because like I said, you'd been the sixth ENT. I'd seen 5 others.
Right.
And so it was
What's going to be different?
Yeah, what can you do for me that isn't going to change anything? You're probably going to send me for a sleep study and tell me, move on.
Right.
And then I'll just be walking out of your office angry.
Okay.
And I had no hope. I really did. I had no hope when I came into your office that life was going to change.
But when it did, then you told me you wanted to apologize to
Dr. Q.
And, my office staff, because you were a little short with them.
Yes, especially when I couldn't get it done in office because
Right.
my blood pressure was so low.
That's right.
And it was rightfully so that Dr. Q called it off.
That's right.
Because something really could have happened. And when I woke up in the hospital, my blood pressure was 135 over 100, and it's never been high. So I believe during the surgery, they must have given me something to raise it so that it would be safe. And when I looked at that, I thought, God's really watching out for me here, and he's given me a wonderful doctor.
We made the best decisions for you.
Yes, you
We
did.
wanted to do it in the office, but it wasn't going to go that day.
Yes, and I don't mind, and that's why I called. I took responsibility for my actions and said, listen, I'm sorry. I don't have any right to treat anybody that way, especially when they're looking out for my life and my health. And that's how I felt completely, was that it was disrespectful, it was rude, and you guys were mostly concerned about what would happen. And me just, because even if I'd signed a DNR at that time, I probably would have died in your office. I mean, anything could have happened.
We didn't want that.
Yes, and your staff was amazing. They were on the phone with the hospital. They got me in very early in the morning. At 7, the surgery was there. And I mean, y'all were quick. Y'all got me in there, and it was like too sweet. And I woke up and I'm like, okay.
Done.
Yeah, and the throat thing was I think the hardest, because I like hot coffee.
Oh, yes.
And so it was the recovery as far as like the cold food and then the lukewarm food and then
Right.
finally having a hot coffee that really was hard. And I drank like cold coffee afterwards because I know you don't like caffeine.
Yeah, we don't
But
want you to bleed.
yes, but I'm not a bleeder. I'm a
Yeah,
clotter. So
right.
it was one of those things where I tried iced coffee and I'm like, this does nothing.
But you're back at it now.
Yes,
You're
I'm
having
back
your
at it
hot
now.
coffee. Everything's good. You just had to
Yes.
go through that little short period that you had to follow instructions, because we want everything to be just fine.
Yes.
No complications.
If you follow the instructions and do what you're supposed to, you're going to have a wonderful recovery and you're really going to change. You just have to follow the instructions and do the rinses. And the rinses, sometimes it gets to the back of your throat and you're like, oh my God, this is awful. And you're gagging and coughing. But you know what? It's worth it.
It
because
keeps things moist so they heal faster.
Yes, exactly. And not only that, but it helps heal the sinuses, just killing off the germs. And because salt kills germs. So it's just naturally that way. And, it works best. It's just the one thing. And I still do them.
Good.
I still do them for my own sinuses because it's like, it helps. I've cut back to 3 times a day because I don't have to do them as often now. But I still do one in the morning, one at lunchtime, and then one at dinner or after dinner, in the evening before bed. Because you have to. You find that you feel much better. You find that you're not getting sick as often. So,
Well, again, I want to thank you for coming on the podcast. It's been a pleasure talking to you. I'm so happy that you're doing well. I'm glad you conveyed to everybody out there, you can do well too. You do not have to suffer with symptoms that just nag at you and don't allow you to live your very best life.
exactly. And I'd like to thank you for having me today because I'm glad to tell my story to everybody.
Well, I'm glad you did too.
Thank you.
You're welcome. That's it for today. Until next time, stay curious, stay healthy, and keep shining. Don't miss our next episode of Clearing the Air, a prescription for life, packed with more conversations that matter. Be sure to subscribe and share with those you love.